Welcome to the Combinations Podcast, the podcast from North Staffordshire Combined Healthcare NHS Trust. And today we've got a range of guests from different areas on this podcast to talk about how they're implementing culture of care. I'm Kyle, the digital content lead, and we're talking culture of care. So if you won't mind introducing yourselves and what you do, if you work for the Trust or not.
Hi, I'm Rachel Bloor. I do work for the Trust. I'm Head of Nursing and Professional Practice.
Hi, I'm Sarah. I work on Ward 6 at the Harplands. I am a nurse and also the ward manager.
I'm Sherrine. I'm the Senior Peer Support Worker at North Staffs Combined Trust.
And I'm Anna Roach. I am a Quality Improvement Coach working at the National Collaborating Centre for Mental Health.
Brilliant. Welcome all. Culture of care is a new thing to me. When I'm in comms, I do get to know some of the projects, and I've been fortunate to come along and start getting the wheels turning on culture of care. We've obviously been out and created a film for it, but obviously this is fairly new to others. So really I need an introduction to the audience of what is culture of care and why do we need it?
Thanks, Kyle. I think it's really important that you say it's new to everybody, and it's taken some time for us to understand it as well. So for me, it is the 12 standards of care, and the idea is that these standards of care will help to improve the care for patients with a mental illness, learning disabilities or autism that access our inpatient areas. We hope by implementing the 12 standards that we will create an inclusive, equitable environment that's also fulfilling for all of our staff as well.
And I think really excitingly, culture of care is kind of part of NHS England's wider transformation. So it's exciting to work with wards on a national level to make mental health inpatient services more safe, therapeutic and equitable.
So with culture of care, obviously we implement a lot of stuff into the trust to make the care better and always moving towards the best we can. How does culture of care fit into the wider trust priorities like care planning, discharging, all that? Well, how does it fit into the roles of caring?
So I think for me, we've got our proud to care values as an organisation, haven't we? And so the 12 standards fit into our proud to care values. And our vision as a trust is to always be outstanding in everything that we do and how we do it. One of our priorities, our quality priority, is about providing the highest quality, personalised, safe and effective services for people. And the 12 standards for me just really support us in implementing and for most importantly, I think for me, the difference around this compared to other things that we've done in the past is that it's truly being co-produced and that we involve our patients and our carers and our staff at the heart of where care's being delivered to make decisions, come up with ideas, whatever that might be really. And that's what's really exciting and unique about this implementation really of the standards, is that we've got the scope to really do that. So I'm really excited about them.
And that's what it's about, isn't it? It's about getting everybody's perspective from the ones being cared for and the ones giving the care to try and get the best for everyone. And obviously we've been doing that as a trust. I want to go over to Anna because you're, come into our trust from an external to support us on this journey into culture of care. And I just want to know, what's it been like working with us and what can you bring?
Yeah, of course. So nationally, the Culture of Care programme is being led by the National Collaborating Centre for Mental Health. And we also work with some fantastic partner organisations to ensure that we're able to help trusts develop trauma-informed ideas, autism-informed ideas and anti-racist approaches. So from the beginning, this is all really entrenched in co-production and it's wonderful to work with so many different experts and voices. It's been wonderful working with North Staffordshire Combined Healthcare Trust. I've had regular meetings with specific ward teams where we've come up with initial ideas of what they might want to change on the ward, and then going forward have regular fortnightly coaching sessions with the ward teams to investigate and plan out the specific changes that they want to see happen on the ward.
Brill. So you've enjoyed working with us and seeing what we've implemented so far?
Yeah, it's been fab, and it's such a range of different people that the project teams are made up of. We're working with a range of different patient groups. And what's been really exciting is just the enthusiasm that the teams have had and the creativity in which they've kind of approached the whole project.
Yeah, when I was recording the video that we're doing to help launch Culture of Care, I was working with one of our ex-service users who's now part of Culture of Care, and he said it was a real buzz, and he was like, it was nice to see that there's such a side that he can bring, and he's coming from a volunteer side of the trust, so he's kind of, well, he is one of us, but he's a volunteer, but to give back to the services was something that he was really proud of, and you can see that in the video.
Yeah, I think one thing that North Staffs are doing so incredibly is involving those voices, and the way that they've set up doing Culture of Care within their community meetings is really special example of this being done well.
And I think it is time to come to the ones that are sort of running the show. We've got Sherrine and Sarah who are going to come and give their knowledge on, how it's running on the shop floor, essentially. I like to call it that. And how have the community meetings been set up? What's their purpose? And this TRIP framework that everyone talks about with the Culture of Care.
So I think for me, initially when we were looking at Culture of Care and I went to some of the TRIP framework sessions, I think initially it was a bit worried. We were a bit worried about how it was going to go. It is very new and it was looking at a different way of working, although we already do a lot of joint working with patients, with carers, with families and the MDT. So I think for our patient group that I have on Ward 6 at the moment, they can be very complex due to their cognition and interaction. So I think that was a bit of a worry initially. However, having sort of the support from the peer support worker and the leads joint working with themselves, it's become a really exciting opportunity for us on the ward. And we sat down as a team and we started looking at how we could implement this on the ward with the patient group, with carers, with the support workers to make it more exciting and interactive. So we did have to be very creative. And I think it's something that's started to flow really, really well, and it's brought new ideas with staff and patients, and it's given us open opportunities now to bring wider MDTs in, the peer supporters, and give us lots of projects to work on, which we have already started to implement on the ward.
Just echoing really what Sarah said. So I'm on Ward 3 and that's the women's ward, and we hold ours every Thursday at 2:30, and we quite like that because we know everybody knows that they are happening, where I know some wards are doing it slightly different to fit there. I feel because we're I'd say a couple of months in, I'm seeing a real shift and a real change, where because we've had some patients that have been there on a longer term, and because of staff obviously with the rota, and we're seeing different staff, but I've seen a real shift in the patients feeling valued, and that when we're in that room for that hour, and what's nice is we coordinate the questions between us, so not one person is reading the questions, so it sort of eliminates the power dynamics for everybody in the room. That's all staff and patients and carers. But I'm seeing that sometimes we do rephrase some of the questions because they can be a little bit wordy, and there's a lot, which is really important because we've got to make sure that we're getting all that information, but giving people that chance to pause and to reflect, giving people a couple of minutes between the questions and to score, and actually role modeling that. I feel like that the patients particularly are really feeling confident, and we're all a team in that room. There's not us and them. It's not patients, peers, ward manager. We're all a team, and that's really shining through, I feel.
I think as well, Kyle, just to add in terms of TRIP, because it is an abbreviation, and we've become really familiar with trying to abbreviate it. So it's the Team Recovery Implementation Plan, and it's guided from IMROC, which is a framework for creating recovery-focused services. We thought when we first started to learn about the 12 Culture of Care standards, and we were thinking about how we might implement them, the TRIP framework because we were familiar with it from IMROC, we thought would be a really good place to start, because it gives us that kind of self-assessment documentation to work at, and we can use it in many different ways. So we've used it across all of our areas in the form of a community meeting where we hold recovery conversations and we talk about how things are going now and what we want things to look like. But we can equally share that with our carers as well, so people can take it away and feedback to us around that. So the framework really is just giving us a bit of a baseline of where to start, and then we will move forward into an ongoing project of change ideas that continually just becomes from this co-produced meeting and co-produced conversations.
I think for us on Ward 6, just following on from what Sherrine and Rachel have said, it started to be very exciting when we got creative. So Sherrine obviously mentioned the way that she's working on Ward 3 with their structure. For Ward 6, we had to suddenly become very flexible and change that to meet the patient's needs, to meet carer needs. So for us, we don't have particular days or times. We pick different days each week, or we pick weekends and different times. But because the nature of the questions for our patient group might not be sort of easily answered, we've had to look at the different ways that we can achieve what we want from this, from a patient recovery way. So we've started doing different days, but we've brought in activities. So for our patients, we can't just sit down and hold a meeting in a room as a group or one-to-one. So we've introduced therapeutic activities to get what we need from these meetings. So we have held therapeutic art sessions, we've had craft sessions, we've invited carers to these sessions, we've held them with patients. Staff are always very open and wanting to join in. And as Sherrine said, some questions we've had to adapt and make them a bit more simple to get the outcome from the person that can't always express the needs that they have, or their beliefs or wishes from the ward. And following on from these meetings we've had, it's introduced quick wins. So from the carer point of view, we've held the carer link meetings. We've discussed lots of ideas on the ward that we do and to support them really. So we've now implemented discharge flow charts. We've now got discharge boards with more information that has come from some of the questions that we've had with carers. From patients and staff, we've looked at the environment and how we can make that more interactive and therapeutic. So we've now implemented a reminiscence walk around the ward. So we did have some walls that had maybe just some pictures or different things that patients have done in the past. And for us, for our patients, they need distraction and therapeutic interventions. So we've now implemented interactive activities on the walls that's a focus for our patients. If they're starting to become distressed, staff can engage in them conversations with them using the therapeutic activities we've put on the ward. And from that, we've also identified more as sort of an ongoing QI project that we're doing on the ward to improve things. We are now implementing a reading corner, because patients and staff were saying, you know, for some of our patients to relax more at night, or patients that perhaps can still read and can engage, or patients that maybe can't read but still like somebody to read to them or have an audio book. So we are in the process currently of turning one of our garden lounge areas into a corner that can be patient focused, carer focused and staff focused, for them to go and interact and have all of that intervention, and it meets patients' needs. It then produces, you know, relaxation before night time, and it's given us lots of food for thought on the ward, and all the staff are enjoying it, and it's just improving lots of new joint ways of working together to get the best for the patients.
One thing that's been so exciting is having these regular coaching sessions with Sarah and Ward 6 and exploring the ideas that have come out of the community meetings, and working together to plan how that could look like on the ward. So what kinds of things can we measure to see if it's making an impact? What kind of feedback are we getting from patients, from carers? Always bringing it back to the patients, always bringing it back to these meetings. And it's just such a wonderful example of one of our main principles of culture of care is co-production. And then we're using quality improvement methodology, or QI methodology, to test out these ideas. So we've just got a better understanding of what that looks like in practice.
I think just listening to what Sarah said just shows how like it's already impacting the patients. Like we're talking about these groups that have been set up, and then what we talk about in the groups then gets put into the ward. But it sounds like, you know, we've only been going a couple of months, but patients are already having loads of benefits from it who, you know, might not even partake in these meetings. So it really does show there's a lot of growth going on towards culture of care. And I think when I thought about culture of care, it sounds like you implement one project across all the 8 wards that we're doing it in. But actually, because there are individual groups, then there's technically going to be 8 culture of cares happening at the same time, and it's tailoring the service to be what the patients want for the needs of the ward. Because obviously we've got elderly wards and then we've got acute wards. They're completely different scenarios, and to have these almost personalized groups is what's, you know, pushing this quality of culture of care.
I think you're absolutely right, Kyle. And I think in the past we have seen where projects or, you know, implementation around change ideas and improvement for culture has been something that has gone across the board for services. I think what we know is our services are so unique, each and every one of them, and the people that use our services and those that care for them equally have differing needs. So it is about us being able to be really fluid with the programme, that we can have these co-produced conversations. What we have now will be different in 6 months' time, and that's what's really important about keeping these going. And for me, why I was really passionate about starting from this perspective, so that we can really embed that these are the things that we discuss every week with our patients and our carers, to be able to meet the needs of the public that use our services, that is ever changing really. So I think that's why we all really love, and I think that's why everybody's got really on board with this, because it's not just one straightforward change idea. It's what's coming from our patients, from our service users and our staff. And that will vary. Sometimes they're very small ideas that have huge impact.
One big thing that you can really see within this trust is that like everything's coming from ward level rather than board level, and that's personalised and it's really working, and it's a huge benefit of being able to use some quality improvement methods as well to try and test impact of ideas that really matter for our patients and their families.
I just wanted to follow on really from what Anna was saying. You know, it has shown a major difference already for our staff and our patient group, and we are very much focused on person-centred care and involving everybody in the patient's journey from their families to the patient. That's the heart of what we do on Ward 6, but I think the culture of care has just helped us to flourish even more, and the staff are so excited when we're saying, right, when's the next community meeting, when are we having the next activity, and it's giving us them conversations of what we're going to do next, because we have to think outside of the box of how we're going to have the interactions because of our patient group. And it's just giving us more ideas, more excitement, wanting everybody to work together even more, and it's just bringing us bigger and better as a team to improve everything we already do even more. And for me, I think culture of care is something that I want to just continue to do and continue to grow and embed everything into that day to day in what we do really.
I think that's what it is. It's fresh eyes coming into something that's forever changing. And I think that's why it is exciting, because you can ask the questions and hear the thoughts of the service users and the staff, and probably sit in the meetings going, I would never have thought of that, but we need to try it. And I think it is that QI approach and looking at something and going, this isn't working, how can we make it better? But instead of, like you said, coming down the chain, it's actually starting where the problem is and going up and showing others. So I want to go to Sherrine and ask her, you know, your part of the role is very peer focused. I want to know what the peers are thinking and what, you know, the service users have had to say.
Yeah, so the peers are very excited, and I think what's been nice is because there hasn't really been a peer presence in inpatient services up until the culture of care. We've got peers in the community and our other directorates, but what's nice is, and I guess it's the same as what everybody else has touched on, that the peers have been brought in from design to delivery, so they've been brought in from the beginning. Myself and some colleagues have also been involved with the trip, and we held 3 sessions where if any of the staff who were involved, the pilot wards, could come to and show a little bit of structure of how we're going to sort of run the sessions, the community sessions. But what I feel, and from the feedback from the peers, is when we go into the room and we explain, so I can only speak from my own point of view, and Michelle. So me and Michelle always start off introducing ourselves and say that we've actually been a patient on ward 3, and straight away you can see that people are quite surprised actually. And I think that's really nice, because we're instilling that hope that actually we have been unwell, and we know how difficult that is. And you do get some looks of surprise. The importance of the peer role is really instilling the hope, but also it's equally important because I feel they're bridging the gap of a power imbalance. Now, I was talking to Ben Cooper about this power imbalance, and the way that we perceive that the patient may perceive, that they have very little power, or carers as well, trying to look after a loved one, you feel that you've got very little power when someone's not well. But looking on the flip side of that, as a ward manager, as a deputy, as a member of staff on an acute setting, the enormity of having all the power, and the programme's so big, and almost feeling like I've got the weight of I've got to implement it and make all these changes. So what's really beautiful about the culture of care is that we have the trio. So we have the all the staff, obviously, but the ward staff, the quality coach and the peer, and they coordinate the meetings together, and we always distribute the questions out between us, and then that enables the patient and the carer to feel that actually we are as one, and we're all valued, everybody's voice. I feel, and I'm sure Sarah will pick up on this as well, if someone it might be the first meeting and they can feel a little bit frightened to say, or they feel like, I've had a patient before say, I don't want to cause any problems, and it's not like that at all. Everybody's valued, and I've seen the confidence come out. But yeah, with the peers, I feel that from when I've spoken to other peers, they feel so valued, and staff have got to know them and got to know more about the role and the importance of the lived experience workforce. So it's really nice. It's a really positive experience so far.
Yeah, I think from sort of our peer support, when they come, I think, there was that bit of apprehension. So we had them conversations about, well, actually, this is a work in progress to work together. You are still a voice part of us, and let's have these meetings. And the few community meetings that initially our peer support was coming to, she really felt the same as you, Sherrine, really valued, really involved. I think it did give patients a bit more ease, and sort of carers as well, having other people involved, not just obviously ward-based staff. It gave everybody an opportunity to share their own sort of experience to move forward, to put improvements in place.
And I think what's interesting with this is culture of care is essentially a big change. It's change. And we've been using words like excited for the meetings and everyone's getting involved, which kind of shows that the changes that we're making individually over the different types, different wards, has been taken really well. Like, you've been running the ward on Ward 6, Sarah, and it sounds like it's going swiftly, and the patients and staff are really happy with what has been implemented so far. And from a QI process, is this all bedding in really well?
Yeah, so it is going really, really well. We're looking at different ideas and things that we've never done before. And as I've said before, looking outside of the box, and it's all about that journey that Anna said, being able to see and measure how valuable it's become by implementing these new ideas, and it has shown already in a short space of time, just sort of the reminiscence walk, how effective that's been in distraction and sort of therapeutic engagements with each other. It's also give with the community trip meetings, because we do it through engagement and activities. It's giving family members, carers and loved one an opportunity to have a bit of normality back between sort of each other and their relationships, because sometimes, because of the nature of the patient's illness, when they come to us, carers are really struggling to still be able to engage. So just by us doing an activity of crafts or by an art therapy session, you're finding that carers and patients are enjoying them interactions again. It's give them that newfound love with each other again, I suppose, that they're able to have that maybe they've missed. So even just from the community trip meetings, we can measure that it's showing a good improvement and it's valuable to everyone. And I think with the quality improvement projects we're starting to do and what we want to do, it's only going to get bigger and better for the patients, the staff and the family who come towards it.
And I think with the walk that you talk about, it also shows that you're using your ward's facilities effectively as well. So we're not taking patients out. We're keeping them within the wards. It's a safe practice, and it's obviously working really well. I want to talk about next steps then, because it's good to hear the positivities of what's going on. I know we've got Ward 3 and Ward 6 perspectives today, and I'm sure that the other wards have got stories very similar. But Rachel, Anna, what's next for Culture of Care?
So I think for me, Cal, as I said before, that actually embedding the way the TRIP framework works and being able to really start these co-produced community meetings, that is the future for me. Because as I said, what we discuss now may be very different in 6 months' time, and our population that use our services changes, the needs change. So we have to be able to be responsive to that. So I think that that's the really good grounding for us to be able to really embed and move and shift the culture in our inpatient areas to that really co-produced, recovery focused care delivery. For me, it's that ongoing. We know that there's always change happens in all aspects of our lives, but we know in the NHS change is always needed, but we need to make the right changes, and we will do that from co-production. So I really feel that it is just about how we continue these conversations, how we move it into everyday business, how we make that happen. But what I think is, and I feel incredibly pleased about, because we talked about the apprehension at the start of this, is that people feel really included. People have got a voice, it's equitable, and we're able to really start to shift and move perhaps things that we haven't been able to do before in our inpatient areas to really move that culture. So I feel really excited about it. Anna, I don't know what your thoughts are.
Yeah, it's so encouraging to hear that from kind of trust, your internal trust, because that's what we want. We are running the programme, the official kind of Culture of Care national programme until March 2026. And that's when the kind of regular coaching sessions stop. But I love that we're already talking about how we can embed this into routine care, how we can keep it going. Like, we've only really had a few months of it. So it's exciting to think we're already thinking beyond when the project as such ends, because, and I think this group really recognises this, it's not just a project. You don't just change culture for 18 months and then focus on something else. This is stuff that really gets to the heart of the NHS and why the NHS is good and what we can change. So yeah, the national project and the kind of events and collaborations and stuff will sort of slow down and end towards March next year. But yeah, the hope and promise is that this carries on going and we keep the patient voice at the heart.
The question I want to know is, obviously, I see these 8 culture of cares that we've implemented as separate things. Do the managers meet up and share about what's gone well for them, what's improved on the ward, to sort of involve collaboration within the trust?
Yeah, so we were really keen at the start when we were thinking about this, Kyle, to make sure that we got a really supportive structure around all of the wards, and we knew, and I think people felt that it was ambitious, so we were trying to be ambitious, but we made sure that we have a regular steering group meeting where we all come together and we support each other, and we deliver some of our QI methodology through them meetings as well to support the training and education. And we spoke off, as Sherrine mentioned, and we run different sessions to support that, and that's all driven from the steering group. And then we have our own individual wards that are working together, as Sherrine mentioned, as a bit of a trio, but with the wider MDT, the patients, carers, and then they bring and steer that work to support that and bring it back to the steering group. I think what's really been really great about the steering group over the last few months, and maybe Sarah might want to add to this, I don't know, but from my perspective it feels as though we share things that go really well. And some of the wards didn't, we didn't start this all on the same day. We implemented it across a number of weeks really for different reasons, and so those that started, sort of the early people that started it, would share the things that went really well, and actually that really reduced some of the apprehension around it, and so that sharing of good practice and just peer support from the project groups within the wards with each other I think has been really beneficial to them.
Yeah, I think just going off what Rachel said, I think having them interactions with other ward managers, it does show that, we've all got these amazing ideas that we want to create change, and we're embedding that into everyday practice now. And I think it's nice to share the ideas and to find out what other people are doing on the wards, and it gives you that bit of excitement. Sometimes it gives you, a bit of direction to find out what other people are doing. And I know I've spoke to Anna about this before as well. There's the networking groups that go on across the board as well. And I think for myself as an older person's ward, because we were a bit anxious about that, by having conversations with other managers, seeing what they were doing, it worked really well. It reduces that anxiety. And I think just sharing them ideas between the ward managers and now outside in the networking groups gives other people opportunities to learn and grow about what you're doing, and actually shows that it does work, and it settles them anxieties.
Also, I chair the peer support network monthly, and we've done our peer support, and I've ensured that's on the agenda now, that we touch base and see how we're getting on from a peer perspective. So I think it's really nice that everybody's doing that from a peer-to-peer point of view.
And I think we've really valued the support that we've had from the Royal College in terms of the wider networking, the education sessions, the support from Anna. Really feels that we've got like a robust approach, to be honest, and so that's been really beneficial.
I guess building on Sarah's point, we hold regular national events so that teams can learn and share ideas, so it's encouraging that this sharing and learning is going on at all different levels within the trust and also beyond.
Honestly, hearing this podcast, it makes me want to invite all the ward managers that are part of it, because we've heard Sarah's side and the positivities that have happened on Ward 6. So it would have been nice maybe next time to do another podcast with some of the other ward managers, just to see how much of an impact it's made, because again, we were only looking at one side of it and a bit from Ward 3 with Sherrine, but it's a big project, but it feels like 8 individual projects that are happening at the same time that all have different end goals, which just shows that culture can't be put into a box, and each ward is always going to have the better ways of working with their patients and service users. So thank you all for coming on today's podcast. I'm sure this isn't the last we're going to talk about culture of care, and as it's got another year, it sounds like, to go, it would be good to update on its journey. This is one of those projects that seems to have hit the ground running. Like, we're only a few months in and we've already got a big buzz about it, so that's always good. So let's hope that keeps going at the trajectory it does. If of course you're new to the Combinations podcast, you can listen to it on Apple Podcasts, Spotify and SoundCloud. I hope you've enjoyed today's episode of Culture of Care. Thank you all for coming on, and we'll see you hopefully soon to talk more about culture of care.